Hi folks, I thought I would go through the entire categorization procedure the way I would in the office if I was doing all 7 tests, so you can see the flow that goes into determining the category of the patient. I don't have a plumb line with me here at home, but if I did, I would have my patient stand on the plumb line and face in that direction. And I would look at my patient from behind to see where the string is with respect to her spine. Since I don't usually gown my patients, I palpate the spinous processes to see if they're to the right or to the left of the string. That indicates category 2. Then I would have my patient turn to the side and look at her A to P sway with respect to the string. If there's noticeable A to P sway, anything greater than about a ½ inch, that goes towards category 1. If the patient has antalgia, the pelvis, half the pelvis will be to the right of the string and half to the left of the string. There won't necessarily be a mini schnauzer in the picture, but that's okay. This is not a professional recording studio. And that would, but the lumbar spine would go over to the left or right. Category 3 people have absolutely no motion on the string. The next test that I'm going to show you is called the rib head test. So I have my patient turn away from me, and I place my fingers over the first ribs just lateral to T1. And then I would ask her to look down at the floor and straight ahead again. Keep doing that, just keep doing that. And I'm trying to determine either with my thumbs or with my fingers whether there's hypermotion of one or both rib heads. If when she bends forward, let's say the left rib comes up underneath my fingers, that's unilateral asymmetrical rib head motion, and that indicates category 2. The category 2 weight-bearing sacroiliac problem is on the same side as the hypermobile first rib. If I feel bilateral symmetrical rib head motion, then that's category 1 problem. Category 3s show no rib head motion, and people who are fairly well adjusted most of the time showed also no rib head motion. The next test I'd like to show you is called the stress test. So I'm going to have my patient turn this way, and I'm going to get behind her, and I'm going to have her put her arm out. I'm going to stabilize the shoulder on the same side, and I'm going to tell her that when I say hold, don't let me push down. Hold. Good. Now, we're going to stress out category 1, 2, and 3. The first category 1 stress test is a deep held inhalation. So breathe in deep, hold, exhale completely, hold the breath out, hold the arm. If either of those created an inability to hold the arm at the very beginning of the push, that's a category 1 indicator. Inhalation weakness is the cranial part of category 1, and exhalation weakness is the sacral part of category 1. You'll find that exhalation weakness is much, much more common than inhalation weakness. To test for category 2, I would have my patient lift her right leg completely off the floor, bend the knee, I can hold her up, put the knee back, put the foot back down, and then I test the arm. Hold. And if that created weakness, she would have a left sacroiliac weight-bearing problem, category 2. That should coincide with the same side as the hypermobile first rib. To test the right side, raise your left leg, put it back down, and let's retest the arm, hold. And I'm looking for a weakness or an inability to hold at the very beginning of my push. To check category 3, I will ask my patient to bear down as if she's having a difficult bowel movement and test the arm. Hold, and that's Valsalva's with a muscle test. Turn and face the camera, please. Thank you. Okay, this next test is called mind language, and it's a reflex test, but it's the same arm push. Before we do the mind language test, I'm going to ask my patient to put 2 fingers on the episternal notch area, right where the sternoclavicular joint is, and 2 fingers of the other hand on the belly button, and to vigorously rub out those 2 spots at the same time. This decompensates my patient long enough for this test to come out positive. Then I'm going to ask her to put her left pointer finger tip on her PSIS. So I would find that for my patient and ask her to put her pointer fingertip on that spot, which she'll do now. And then we test the arm just like we did before. Hold. And if that blows out, that's a Category 1 indicator. Then she'll move her fingertip to the L5 transverse process and hold the arm. And if that blows out, that's a Category 2 indicator. Then she'll move her fingertip to the styloid fossa, right in front of the mastoid, right behind the jaw. So I'm going to get up close to the camera and show you where mine is, just so you know, because I've seen some students over the years put their finger way in the wrong place. And hold the arm. And weakness indicates Category 3. These 3 spots are skin reflex points related to what the functional neurologists tell us is homologous columns. I don't know much about homologous columns, but there's a reason why those 3 spots coincide with the 3 categories. So those are the standing tests that we can do. Next, I'm going to ask my patient to lie face up on the table, right here. Actually, stand up again. I need to move the table so that we have room on both sides. And lie on your back, please. And I would go into the arm fossa test. And there's videos on these individual procedures already posted. Hold, 4 fingers together, upper inguinal ligament. Always tell your patient what you want to do. Point to that area on your own body. Hold and hold. And for the sake of this video, I'm going to reach across and do the upper and lower inguinal ligament on the other side. A weakness with this test is pathognomonic of Category 2. The next thing I can do in the supine position is heel tension, and I like to do it this way. Hold the arm. I'm going to lift this leg. I don't want my patient to help at all. And hold the arm. And then I'm going to lift the other leg. Patient doesn't hold, doesn't help, hold. And if there was weakness, that indicates heel tension. Another way to do heel tension is to have my patient dorsiflex her foot towards just 1 foot at a time, hold, and now the other foot. And there would be a very obvious blowout if there was Category 2 going on. And the last test we can do is cervical compaction. Now I showed you I showed you 4 tests standing, 3 tests supine. It doesn't really matter what order you do them in. I like to do standing tests before I have the patient get on the table. So cervical compaction, I'm going to ask my patient to very slowly lift both straight legs off the table about 1 foot and put them back down. Now I'm going to press firmly S to I on the very top of the head, compressing the cervicals. And while I'm compressing, I'm going to ask her to lift her legs again. And if it's noticeably more difficult, and I think it was, we've got something going on in the low back, which is usually Category 2, because Category 2 is about 85% of all your new patients. So I hope it helped to see all these tests done in the order that I might do them in my own office.